What is the best indicator assessing quality of life in a nation? Is it the GDP? Keeping in mind that we are number 4 in the world, and in about 3 years' time, we will be number 3 when we overtake Germany. I personally believe that one of the best indicators, if not the best, is the death rate of infants. That is the infant mortality rate, or the IMR. Now, what is an infant? An infant is a baby up to 1 year of its age, and the infant mortality rate is the number of deaths of babies per 1,000 live births. Now, the average for India is 25 deaths per 1,000 live births, and of course this varies in different parts of the country. It is the highest in Uttar Pradesh, Madhya Pradesh and Chhattisgarh at about 37 to 40. The national average is 25. Delhi, depending on what you check, ranges from 22 to 12. I again personally believe that it is 22. Based upon the data supplied by the Directorate of Economics and Statistics, they have a website and they have an annual register, a register for births and deaths, and this is available. I will provide a link, and this clearly says that in the year 2024, the IMR in Delhi was 22, which is pretty high. Keeping in mind that the IMR in Beijing is 1.4. Now, you are comparing an IMR of 22 with 1.4. That is one humongous difference. What is the IMR in the United States? It is about 5. The IMR in China is about 4. The IMR in England, Germany and France would be between 2 and 3. The lowest IMR where nations are concerned is Japan with an IMR of only 2. But I repeat, the mortality rate in Beijing, the capital of China, is just 1.4, which is a massive difference from Delhi's 22. Now, having given you these numbers from India and other various countries, the next thing which I will talk about is this very interesting study which has been published last week in JAMA. JAMA is the journal of the American Medical Association. It is a heavy-duty journal, a medical journal, and this is a very interesting study which associates exposure to air pollution during pregnancy and the birth weight. What the authors or the researchers find in almost 16,000 pregnant women in America with a mean age of about 30 years is that when the 2.5 level is high, then the birth weight is low. Now, we all know that a low birth weight, that is a baby born with a suboptimal weight, is more susceptible to infections, sepsis, breathing problems, and in fact mortality and diseases, and even diseases later on in its life. Now coming back to the study, we have the study with 16,000 or almost 17,000 pregnant women, mean age 30 years, and the authors find that when the 2.5 level is high, the birth weight is low. The average birth weight here was around 3.4 kilograms. Now remember, the average birth weight in India is from 2.8 to 3 kilograms. We are lighter at birth. This is a fact. and a low birth weight is defined as a birth weight below 2.5 kilograms. Once again, I come back to the American study. The authors have adjusted for the age of the pregnant woman, her weight, education levels, smoking status, the ambient temperature where she resides, and they find that when the 2.5 level is high, the birth weight is low, and more importantly, they find a critical time, a critical duration when this association is most effective, that is in the first 4 weeks. The earlier weeks, 1 to 5 weeks, is the critical time, and surprisingly, boys are affected more, which means that girls are not affected, but boys are affected more if this particular woman is exposed to a raised 2.5 level. Now, astonishingly, the average 2.5 level here in the study, that is in the United States, was just 8.4 micrograms per meter cube. I will once again give you the definitions. Particulate matter 2.5, which is a very small size, and 2.5 microns is 2.5 millimicrons, which is smaller than your red blood cell and your white blood cells in your body. And because it is so tiny, it is microscopic, it can enter your bloodstream via your lungs and create havoc in your body. Now, what is happening in these pregnant women is that when they are exposed to a higher level of PM 2.5, the 2.5 is affecting the placenta. The placenta is the organ which is formed during pregnancy, which provides oxygen and nourishment to the baby and removes the waste products from the baby. So it behaves like the lung, liver, and the kidneys for the baby. So the placenta obviously is a crucial organ, and if this gets compromised, if this gets inflamed, or if there is oxidative stress, or if there is a problem in the DNA, in the growth of the placenta, then naturally the nutrition supplied to the baby will get compromised, and the result would be a smaller sized baby, a low birth baby. And this low birth baby would be prone to illnesses and worse, to deaths. Now come to the 2.5 level of Delhi. The threshold for a normal 2.5 in the United States is 9. By the WHO it is 15. In Australia it is 10. For some inexplicable reasons, ours is kept at 40 micrograms per meter cube, which is very high. I don't know why this has been kept at 40, but the important thing is that even now, if you check, there will be various websites giving us the 2.5 levels in Delhi right now. That would be ranging from 170 to 200. In fact, I checked a website called AccuSure that gives a range that is, it could go up to 600 today. So anyway, we have scandalously high levels of 2.5 in Delhi because of obviously air pollution, and these levels are bound to affect these young ladies who are pregnant. And remember, the effect is maximum during the first 4 or 5 weeks of pregnancy, and this is the time when a lot of women are unaware that they are pregnant. So by maintaining this level of air pollution, not only are we damaging the brains of the population, that is, we are causing dementia, Alzheimer's, brain tumors, we are damaging lungs by aggravating asthma, causing chronic bronchitis, and even lung cancers, and of course, my territory, it can exacerbate heart attacks and strokes. So apart from this, these illnesses which are affecting the adult population, by ignoring this air pollution, which we are, by ignoring this air pollution, we are directly, indirectly attacking our own children, our own babies, right? Because remember, the IMR of Delhi is 22 as per official records of the Delhi government. Thank you very much.